want to talk a little bit more about the issue of health care because it is driving the entire debate here in Washington today. I've talked about principles in health care: accessibility, affordability, quality, responsiveness, innovation, and choices, and that none of those principles are improved by the intervention of the federal government. And I don't think there's a single American who sincerely believes that they are improved by more imposition of rules from Washington. So if you believe that, if we believe that, then the president would have us believe that there's only two alternatives, that it's either the government in charge or it's the insurance companies in charge. Well, Mr. Speaker, that's a false choice. That's a false premise. In fact, it's not just the government in charge or the insurance companies in charge. In fact, there's a better way. There's the right way. There's the correct way, and that is to put patients and their families in charge. And how do you do that? To put patients and families in charge so that accessibility, affordability, quality, responsiveness, innovation, and choices are all improved. In fact, all of the principles in health care are improved if the patients are in charge. In fact, the system moves in the direction that it ought to move. And, Mr. Speaker, the direction that our health care system ought to move isn't the direction I, as a physician or member of Congress, believe it ought to move. It isn't the direction that you believe it ought to move. It isn't the direction in which our collective intelligence here in the House believes it ought to move. The direction that it ought to move is the direction that patients want it to move. And the only way to do that is to allow patients to control the system. And the bill that will do that, Mr. Speaker, is H.R. 3400. H.R. 3400. You can go to the website for the Republican Study Committee, rsc.price.house.gov. Look it up. It's right there. There's a side-by-side with H.R. 3200, which is the Speaker Pelosi's and the Democrats in charge here in the House, their monstrosity, 1,000-page-plus bill that would provide for a government takeover of health care. Or there's a responsible way to do it, H.R. 3400. Now, what does H.R. 3400 do? Well, it does 5 things very specifically, in addition to a lot of other things, but 5 big things. One is that it gets Americans insured. It's imperative that we make certain that those individuals who are unable or appear to have the lack of resources to be able to finance health coverage for themselves or for their family have the wherewithal to be able to do that. Now, how do you do that as a good conservative? Well, you make it so that for every single American, it makes financial sense to be insured. Americans are bright people. They're making financial decisions right now not to be insured. So we devise a system, create the rules of a system that will respond to patients, that will make it so that each and every American citizen sits down at the end of the day, and when they're doing their budget, they realize that it makes more sense for them financially to be insured than not. And you do that through a series of tax deductions, tax credits, refundable tax credits, advanceable refundable tax credits, tax equity for the purchase of insurance so that individuals are able to purchase insurance with pre-tax dollars, just like businesses, instead of post-tax dollars. So you get folks insured. Secondly, you got to solve the challenges of the health insurance system right now. There are wonderful things about our health care system. There are also some things that are flawed. And those things that are flawed we ought to solve. And they're relatively easy to solve. For example, the 2 main issues: portability. You ought not lose your insurance if you change your job or you lose your job. Just ought not be the case. Pre-existing injury or illness. If you happen to have a diagnosis that results in a major calamitous event for you or your family from a medical standpoint, or you have an injury that results in a major expenditure, you ought not be priced out of the market. You ought not lose your insurance. That's wrong. And so how do you solve that? Well, you make it so that individuals own and control their insurance policy so they can take it with them if they lose their job or they change their job. And in addition to that, you make it so they can pool, Americans can pool together with millions of other people for the purchase of insurance, so that you get the purchasing power of millions, even if you're one individual or a small group or a small employer in that market to purchase health insurance. So you solve those challenges. You get folks insured. You make certain that you solve the insurance challenge. Third, and as important as anything else, is to make certain, absolute certain, that it's patients and their families and doctors who are making medical decisions. Not government bureaucrats, not insurance bureaucrats, not anybody else. Medical decisions are some of the most personal decisions we ever make in our lives, for ourselves and for our family. We ought to have the right, we do have the right, we ought to be able to exercise the right of making those decisions ourselves. It is a sad commentary, Mr. Speaker, right now in America, that in order to get that accomplished, you have to write that into law. That's a sad commentary, but it is indeed where we find ourselves right now. So 3400, H.R. 3400 says that nobody else in the federal government or the insurance industry will be able to make decisions as it relates to the provision of medical services and care for individuals or members of their family. Fourth, we solve the issue of lawsuit abuse. Lawsuit abuse, the lottery mentality that we have created in our society that makes it so that individuals believe that if they just hit the right note, if they just are able to find the right cause of action against a physician or a hospital, that they might make millions. And that results in the practice of defensive medicine. And the practice of defensive medicine, Mr. Speaker, is those tests and examinations that your doctor performs or orders in order to make absolute certain, to as much scientific certainty as one can, that the diagnosis or the procedure that he or she proposes for a patient and then carries out is backed up by all the knowledge and evidence that's available to them. So that if they find themselves in a court of law at some point, they can look at the judge and the jury and they can say, look, I did every one of these things to make certain that what I proposed to do and what I did was appropriate for this patient. And the judge and the jury nod their head and say, yeah, he or she did. And it doesn't make any difference whether the first two of those things were all that was necessary to make the diagnosis or to perform the procedure to cure the patient. The next 15 or 16 were superfluous or redundant or duplicative. But that's the practice of defensive medicine. Hundreds of billions of dollars each year. And it's not necessarily that it harms the patient, because it doesn't. But it makes it so that the system spends so much more money than it has to in order to provide the care that it currently provides because of the lawsuit abuse that we have. So, Mr. Speaker, we can have everybody insured. We can solve the insurance challenges. We can make certain that medical decisions are made in their rightful place. That is between patients and families and doctors. And we can solve the whole issue of lawsuit abuse. And the fifth item in 3400 is that we can do all of those things that would solve 99% plus of the challenges that we face in health care. All of those things we can solve without raising taxes 1 penny, not 1 penny. And so, Mr. Speaker, when we look at 3400 and we compare it to the bill that's been passed through 3 committees here in the House of Representatives by the Democrats in charge, a $1.3 trillion monstrosity, a 1,000-plus page monstrosity that results in an $800 billion tax increase and a $500 billion slash to Medicare programs. When you look at that's why the American people are confounded. They're confused. They don't understand what's going on because they know that that's not the solution. That the majority party, that the Democrats in charge, that the Democrats in power are taking us down a path that is not consistent with what they believe. And so they cry out and they clamor and they say, over August and earlier this month, they say, why aren't you listening to us? Why aren't you listening to us? So the opportunity that we have in this chamber and in the Senate, right down the hall here in the Capitol, to solve the challenges that we face in positive ways that make fundamental American principles come to the table is so wonderful. We've got a great opportunity. But in fact, we're ignoring that right now because of the leadership that we have, because of the lack of leadership from this Speaker and from this Congress to put in place, to allow to be put in place, the positive solutions that are available to us as a nation.